You're watching EASD TV. Now, we thought we'd seen the back of COVID-19. It's very clear now it's still with us. Not only rolling waves of new variants, but also long COVID. And one of the many presentations on COVID-19 has been specifically on long COVID. And I'm joined by Stefan Bornstein from Dresden. Stefan, long COVID is really becoming a very serious problem, isn't it?
Yeah, it is indeed a huge problem. We are talking about almost 20 million people, according to some recent survey of the World Health Organization, just in Europe, affected by long COVID, or it's better to use the term post-COVID, which is that it persists over more than 3 months. And it really has led also in the United States to the formation of a ministry subgroup that is just focusing together with CDC and NIH on this problem affecting so many people.
But there is a particular link with diabetes, isn't there? Not only for those who had diabetes before COVID, but also for those who've developed diabetes after COVID.
Absolutely. I think that this pandemic has been building on the previous existing pandemic of diabetes. We just look at the map of the world. You know, we all know this map of distribution of diabetes around the world, and this is quite nicely, or in a very prominent way, overlapping with severe COVID and people that died of COVID. So in a way, the same is true for long COVID and post-COVID. There is definitely diabetes and the whole metabolic syndrome, including hypertension, lipid disorders, are a risk factor. And as you said, it's in both directions that this metabolic and endocrine disease is driving infection susceptibility, and infection by itself may lead to metabolic changes that may even turn up quite at a later time point.
Do you think that this is people who would have got diabetes anyway in later life, so that it's accelerated a diagnosis of diabetes, or do you think it's something else?
We've been currently working with a registry worldwide led by Francesco Rubino and Paul Simmet and others, where we're looking at about 1,000 patients that have developed type 1 or mostly type 2 diabetes, or something that is maybe sort of a form of a transient diabetes following infection with COVID-19. So it will be very important to keep on monitoring these patients for a longer period, including the long COVID or the post-COVID phase, and see what's happening. It may go away, but it may then, a year later or 2 years later, again, metabolic changes may appear, as what has been actually seen with the first SARS infections.
What about treatment? Because, as you say, there's an enormous number of people across Europe with long COVID, which is preventing them from working and for doing many tasks of daily life. And you often hear of people who were very fit and healthy before, who are completely struck down by this and unable to function at all. What kind of treatments are we looking at? Are there any?
Well, currently, people are focusing on understanding mechanisms. It's a very multifaceted syndrome, including chronic fatigue and the symptoms of this pressure on the head, this helmet-like feeling that people have and that they are not able to work. I think what we are doing, or let's say what is currently done quite a bit, is we believe that aphoresis may have a role, but it's not validated. What we need is a clinical trial. It's done in centers around Germany and other countries. We have waiting lists of 10,000 patients waiting for this treatment. There could be a rationale.
What's the purpose of the aphoresis? What are you trying to achieve with it?
So aphoresis, extracorporeal aphoresis, or immune aphoresis, is practically a way of removing toxins, maybe autoantibodies. It seems to be an autoimmune process, inflammatory proteins from the blood, giving back the clean blood to the patient. And it may also be simply just a rheological factor. It means that the clotting has changed, or the capillary system, and that may be reactivated and through the aphoresis, as we know from from other patient groups that we have been looking at may lead to some improvement. What we don't know is if this improvement is transient and how long it will stay on. And for that, of course, we need a randomized sham-controlled trial to move that forward.
What about a platform trial like the recovery trial, which of course gave us dexamethasone and on the other hand discounted some of the other proposed treatments for COVID?
That's absolutely what we need to move forward. At this point, there are just reports, anecdotal reports. We have looked at some of our own patients. That is just individualized trials, but lots of patients in some of the private centers have been treated. And what you see is that about 70% seem to have some improvement. What we need to know is that some of these protocols, in addition to using this washing of the blood, this aphoresis technology, they have been treating them in addition after aphoresis with dexamethasone or with prednisone, with anti-inflammatory, other dietary substances. So we need really a defined and controlled trial. Otherwise, we are not moving forward in a scientific way. But the need is absolutely there.
So in this sense, diabetologists can play an absolutely key role because it's their patient group that seems particularly badly affected in making sure that there are proper registries, there are proper trials, and we don't do what we've seen in the US and other places, hundreds of little trials making absolutely no difference at all.
Yeah, no, I think this is a call for a large trial, including some of the treatments that are now out there, and including aphoresis, immune aphoresis, and then we can hopefully offer something. And this will not go away. You know, there's always been a post-infectious long virus syndrome. It was not just so prominent with the pandemic of COVID. But if we have a treatment for lots of these patients that suffer from a post-infectious fatigue or whatever, it will be useful even if this pandemic hopefully at some point is over.
There's such a need for this. So I'm sure that most of you watching this will have patients who have developed long COVID. And I know that you will be particularly interested in what Stefan Bornstein has to say. So do look at his presentation online or indeed go to it. More later.